I'm Talitha Vickers. We are breaking into programming now for an update on the COVID-19 pandemic. The governor is speaking. Let's hear him now from Raleigh.
COVID-19. As of today, North Carolina has 3,426 confirmed positive cases and sadly 53 deaths. We've learned that test results have revealed a hotspot of transmission in Orange County. A series of tests for COVID-19 have revealed that at least 60 positive cases in a skilled nursing facility in Orange County, with more likely to come. Of those, 7 are hospitalized and 2 have died. These are shockingly large numbers. And I wanted to share some information about what the state is doing to combat and control outbreaks at long-term care facilities to protect both residents and staff. We're tracking these outbreaks closely because we know that by nature they can be hard to control. As our concern has grown about long-term care facilities, the North Carolina Department of Health and Human Services has added data to its public dashboard. One of the items being tracked and shared is the number of outbreaks at congregate living facilities, nursing homes, residential care facilities, and correctional institutions. And we are taking steps to safeguard people. First, we have to do everything possible to prevent an outbreak to start with. My earlier executive order has restricted visitors to these facilities. And the Department of Health and Human Services guidance suggests that workers wear protective gear and monitor their health. Direct guidance on closed shared common areas and sanitation are also in effect. Dr. Mandy Cohen has and will issue additional directives that she will talk about in a minute to address this situation. Second, we've accumulated enough testing supplies to respond quickly and aggressively to assess patients and staff in these situations. And this is important because we know that this virus can spread even before a person is showing symptoms like a fever or a cough. This increased testing will tell us which employees or residents may have the virus but aren't showing symptoms so that they can be isolated. And third, we must take immediate action to stop the spread of COVID-19 in this facility and others. In coordination with local and state health departments, facilities that have residents with the virus will group them into a separate area of the facility to make sure that they are cared for by a separate group of staff. This will prevent interactions with residents and staff that are not COVID-19 positive. The increased number of cases highlights the importance of our work to get more hospital beds and the medical workers to staff them. Yesterday I talked about several upcoming executive orders. One of those will be signed today. That order allows more health care providers into the system, and it makes sure that equipment and other resources are available where they can be most effective and save the most lives. The order also increases the number of hospital beds that may be needed for this crisis. In addition, the order streamlines child care rules to make sure that the children of our most essential workers can be cared for while these brave parents do the work that we need them to do. Finally, again, I encourage everyone to follow our stay-at-home order. Follow our stay-at-home order. This pandemic has shown us how interconnected our society truly is. Going out for a non-essential reason may feel harmless if you're not having any symptoms. But if you do have the virus, you could set off a chain reaction unknowingly by passing the virus off to even just a handful of people. They will pass it on to more people, and so on. Or you could go out and you don't have the virus, but you could easily pick it up. Eventually, it could afflict a nursing home like this one, or a friend or a relative who is already sick with an underlying condition. The more we stay at home, the more lives we save. It's that simple. With me today, we have the Secretary of the Department of Health and Human Services, Dr. Mandy Cohen, the Secretary of the Department of Public Safety, Eric Hooks, and Director of Emergency Management, Mike Sprayberry. Sign language is provided by Nicole Fox and Brian Tipton, and behind the scenes, Spanish language interpretation is provided by Jackie Medevere and Jasmine Medevere. I'll now recognize Dr. Cohen for a few remarks. Dr. Cohen.